Hello, in this video, I'll be speaking to you if you've been newly diagnosed with breast cancer. I'm going to go over 7 questions that you can ask. Before I go on, I'd love to invite you to subscribe to our channel. We put new content out all the time and update pre-existing content, much of which comes from your questions and comments in the chat below. I'd also love to invite you to go to yerbba.com to get your personalized report. I'll be talking about that more in just a moment. So the first question to ask when you've been diagnosed with breast cancer, you're meeting with your medical team, or they're messaging you through the portal is, what kind of breast cancer do I have? There are different ways breast cancer cells can appear under the microscope, and finding out the particular type of breast cancer can be really useful as you research what to expect and your treatment options. Another thing you'll want to know is what stage is the cancer. It's possible that your team won't know that until they've done more tests and maybe even another procedure, but you can ask them what stage they think you have. That's called the clinical stage. And then as new results come out, you can say, what does this do in terms of my stage? Does it change the stage? You'll also want to ask about things like the estrogen and progesterone receptors and the HER2 status. We have videos on all of those that you're going to want to check out if you want to learn more. So what kind of breast cancer do I have? The next thing to ask is, what are the goals of treatment? So by that, we refer to, is the goal to cure the cancer? And although of course it's not guaranteed, there are very few guarantees in life, you want to know what the purpose of treatment is. That can help you when you talk with your family, when you make decisions, when you have side effects, make sense of the whole thing. Are we trying to cure the cancer, or are we trying to control the cancer? You can also ask, how likely are we to be able to cure the cancer? We're really getting here at prognosis. And when you ask about the purpose or intent of treatment, you can ask those prognosis questions like, what if I don't do anything? What are my chances? And if I do what you say, what are the chances it won't come back? That's what we mean when we say prognosis. The next thing you'll want to ask is, what are my treatment options? And the key word here is options. Nobody can make you do anything. These are your choices. The key for you is to understand what's the benefit and what's the downside. So there are cancers in which chemotherapy won't work, or people with cancer where chemotherapy improves their chances a couple percentage points, and they're more likely to suffer long-term effects than to get benefit. In other cases, the chance of the cancer coming back are so high that most patients and most treating doctors will say, we're willing to take a certain risk of side effects because the goal is cure, and the risk of it coming back without treatment is much greater. So it all depends on your tumor, what kind of cancer do I have, and what's the prognosis as you make treatment decisions. The next thing to ask is, what should I expect during treatment? You can ask as many questions as you want to. They're going to tell you what the average person will have. So when you start treatment, you'll get a long list of side effects, and they'll be divided usually into very common, less common, and rare. So that's the sort of information that can help you figure out what to expect. It's important to know that treatment of different cancers is different from breast cancer. So people treated with lymphoma or endometrial cancer, really any type of cancer, will often be treated with different drugs and with a different intent of therapy, length of treatment, etc. So be careful when you think about somebody who got treated either for a different cancer or many years ago. We're doing much better now with side effects and with how to manage those side effects. So what should I expect during treatment? The next thing is, how can I prepare for treatment? What should I know as I go into this? Are there things I should and can do, tests you're going to order? In other words, In other words, what's coming before I actually start treatment and in the early days of treatment? What should I know about being at home or work or with my family, or side effects I should know about? What about foods I'm going to enjoy when I'm undergoing treatment, etc.? Your medical team can answer this, and if your physician is not able to spend the kind of time with you, your treating nurses, the office nurses, social workers can help with all this sort of thing. I'm going to take a brief pause here and talk to you about your Yerbba report. The Yerbba team has added a new feature called Ask Yerbba. When you sign up, it's very easy to do so. You have the opportunity to ask questions, as many as you want, of Yerbba. And Yerbba will get back to you, usually within 24 hours, and answer those questions. There's no limit to the number that you can ask. And the questions are all answered using plain language, no jargon. And if jargon is used, that jargon is explained. This can be really helpful because your particular situation is different from everybody else's, and the answers are tailored and personalized to you and the reports that Yerbba has available. So this is a great option if you find you have a lot of questions you just can't get answered when you're in with your medical team, or things that come up between appointments. So there are really two more questions I want to cover. The first one is, how do we know if the treatment is working? Now, the way that will be answered depends on what you're being treated for. Is this advanced cancer or early stage cancer? Are you getting treatment before surgery or after? Do you have advanced disease and there might be tumor markers or scans that will be followed? So asking that early can help you know what to expect as your treatment progresses. For people who are getting chemotherapy and targeted therapy, let's say before surgery, the doctors will examine the breast to see if the tumor is shrinking, and then before surgery, you may also have more images like an ultrasound, mammogram, or MRI. For people with advanced disease, we will do scans every 3 to 4 to 6 months, depending on how long you've been on treatment. And that can be really helpful for you to understand why the tests are being done, what tests will be done, and how often. And again, that can change over the course of treatment. Just be prepared for that. And then another one that may sound like I've already covered it, but what are the side effects of treatment? And this can be answered not right before your first treatment only, but as your treatment goes along, because the side effects change when your treatment changes, and also as you get further into treatment. Some things get better and some things can get worse. The things that can get better are nausea, and the things that can get a little worse are the fatigue or neuropathy. We have videos on all of these if you want to search our channel. So those are questions to ask your doctor if you're about to go in. We would love to hear your thoughts if there's a particular question that helped you when you were going through this, or if we haven't addressed one of the burning questions that you have, just drop it below. How did you navigate this? If you're on the other side of it, that you might want to share with the Yerbba community. As always, thank you for watching.